So standing here, we can taste the pollution, we can smell the pollution, but we can also taste it, the black soot coming out of the cars, and we can taste it. And that pollution gets deep into your lungs, especially with children that are breathing low by the ground. It gets deep into their lungs, and the very small particulates, the parts you can't see, actually goes into the body, and has all sorts of impacts.
The Child Health Mobility Initiative is working hard to share good practice and to promote activity to give children a safe and healthy journey to school. Townsend Primary School is our London-based school, which is in a three-way partnership with a school in Nairobi and a school in India, in Delhi, and they're sharing experience. They're working together in a way which has never really been done before to understand the problems they're all facing in relation to their journeys to school and to learn from each other.
When the cars are passing, they remove the bad smoke and then I breathe them in, then it affects my lungs and then I start coughing.
We have started to measure pollution around our school, and it's great to hear how other children in London and India are doing the same.
What we're trying to do today in Minimani Primary School is we have an activity with the children where we're trying to understand their journeys from home to school. So what we're hearing from the children are various negative stories around their journeys. We're going to get children to get these tubes, capture the air in order to measure the pollution in and around their schools.
The one way to really get people to engage with something and become passionate about it is to get them to be involved in learning and understanding. So what the magic of these diffusion tubes is not just that it's giving us the data, but it's getting the kids to be hands-on, doing those measurements themselves, which makes them want to be champions of this cause.
This whole concept of getting air quality champions, as soon as you give children that responsibility, they take it so seriously. They're so focused and they're so excited about having that kind of responsibility, especially as something as large as being an air quality champion for your community. You know, it sounds huge. They're the best people to do it because of just the amount of energy and the amount of excitement that they put into it.
Along with our friends in Nairobi and London, we are doing this same tube test to measure pollution in our surroundings. My friends really deserve clean air, clean surroundings and safe roads.
One of the things that UNICEF tries to do very much is listen to children, and yet the voices of children saying, you know, we want to be safe, we want to go to school, we want to learn when we get to school, we want our teachers to come to school. All of those voices sometimes aren't captured in the conversations. We know what to do that makes roads safer for children. So we need to be able to work with those governments to say, let's put in place those things, let's care about the children with simple, relatively cost-effective measures that will save lives.
I very much welcome the Child Health Mobility Initiative. Children are much more vulnerable to pollution than we adults are, so we should make sure that the road from home to school is safe, safe from accidents and safe from pollution.
How do your students make their way to school?
Even when we're walking around Nairobi and our kids are walking to school, the air is really thick and grey and dirty with kind of pollution. So sadly at the moment in Kenya, and specifically in the city centre, in the capital, which is Nairobi, it's not very clean for them.